Medicare and Medicaid are two different healthcare programs that were both established by the Social Security Amendments of 1965. They are operated by different parts of government, and they are designed to serve different groups of people. In this video, I'll give you my visual mnemonic so you can easily remember their differences come test day. Let's take a look at the sign in front of this hospital here. Yep, we're at a center of care, which is obvious by taking a look at that sign that reads, "We care." Seems like I've seen signs like this a million times now. Anyway, the word care here should help anchor you to Medicare, because caring happens here, right? Next, notice the flag decorating the care center's entrance. Yep, there's always an American flag in front of these places. This American flag should help you remember that Medicare is a federal program. Funded and operated by the federal government, Medicare is an insurance program that provides coverage to certain groups of people. Let me repeat this because it's important. Medicare is a federally funded and operated insurance program. Let's discuss who's covered. First, take a look inside the care center to see who's receiving, well, care. Yep, it's our favorite elderly patient who appears to be hooked up to a dialysis machine. I wonder what he's laughing at. We'll get to that later, but for now, just know that this elderly man is here to represent, well, the elderly. That's right, elderly patients over 65 years old are covered through Medicare. Initially designed to provide coverage to older Americans, Medicare acts as a social safety net to reward a lifetime of contribution. The program has expanded since, but the elderly over 65 still comprise the majority of Medicare patients. But wait, we said the guy was on dialysis, right? Yeah, those tubes definitely make that machine look like a dialysis machine. And you know what dialysis makes me think of? You're right, kidney failure. Yep, this dialysis machine is here to symbolize end-stage renal disease, or ESRD. Because ESRD patients have to receive dialysis, right? But also because having ESRD is another way you can become eligible for coverage under Medicare. Next, take a look at the parking lot in front of the care center. In particular, I want you to notice how the space has been marked with a handicap symbol. You know how the parking spaces closest to the door are always reserved for people with disabilities, right? Well, this handicap symbol should help you remember disabilities, as disabled patients under 65 are generally eligible for coverage under Medicare. Before we move on, I also want to note that patients with ALS, also known as Lou Gehrig's disease, are also eligible for Medicare. We didn't make a symbol for this though, as it's an exceedingly rare disease. You're much more likely to come across a patient over 65, a patient with end-stage renal disease, or a younger patient with disabilities. Alright, now that we've talked about who receives coverage under Medicare, let's talk more about the different parts of Medicare. Yeah, you might have heard about how Medicare is composed of 4 parts, namely parts A, B, C, and D. We'll now take a moment to discuss the most important parts and what they each cover. First, notice the birds' nests sitting on top of the hospital. Yep, hospital awnings make great spots for nests of hay? Yeah, hay. At Pixarize, hay is a recurring symbol for the letter A, because hay rhymes with A, duh. And this hay here should remind you of Medicare Part A. Moreover, these hay nests are sitting on top of the hospital, which helps me remember that Medicare Part A covers inpatient hospital stays. Yeah, when you think of Medicare Part A, I want you to think about inpatient care inside a hospital. Just remember Part A as inpatient/hospital insurance, and you should be good to go. Next, take a look outside at the physician getting off work. Ah, now it makes sense why our elderly gentleman was laughing. It looks like our doc here has gotten into some trouble. Notice how he's being chased by a swarm of bees? Wait a minute, bees? Yeah, that's right. These bees are here to help you remember Medicare Part B. Bees for B, get it? The Part B bees are chasing the doc here, which should help you remember that Medicare Part B primarily helps pay for seeing physicians. This is why Part B is also known as medical insurance. Generally speaking, Part B helps pay for bills incurred while seeing doctors on an outpatient basis. I'm talking about doctor's fees, diagnostic testing like x-rays, and any medications administered while inside your doctor's office. Again, the main distinction between Part A and Part B is that Part B primarily covers outpatient care. To strengthen this association, notice how our doctor is running around outside the hospital. He's really putting the outside in outpatient, huh? Anyway, just remember our bees chasing our doc here, and you'll have Medicare Part B down. Alright, now for a quick low-yield part that will hopefully give you some context before we discuss Part C. Medicare Parts A and B are both fee-for-service programs. This means that when Medicare covers a patient's expenses, the provider will be reimbursed for each individual service the patient receives. This means that if you are admitted to the hospital and receive a chest x-ray, antibiotics, and a bed for 3 nights, the provider will be reimbursed for a chest x-ray, antibiotics, and a bed for 3 nights. See? Each separate service gets added up and reimbursed. This is how healthcare has traditionally been paid for, but the big argument against fee-for-service is that it incentivizes healthcare providers to provide as many services as possible. The more services they do, the more they get paid, right? In contrast, a non-fee-for-service program may bundle certain items together and then just reimburse for the bundle. For example, maybe you'll just get charged a flat amount for the entire hospital stay, irrespective of the number of chest x-rays you receive. There's a lot of different ways things can be bundled, so don't worry about the specifics for now. Anyway, this brings us to our discussion of Medicare Part C, which is basically just a different way for patients to get Part A and B coverage. Medicare Part C plans, also known as Medicare Advantage plans, are all-in-one alternatives to original Medicare. Instead of being fee-for-service, Part C takes a different approach. Specifically, the government lets private companies offer these all-in-one Part C plans. The government then pays them a certain amount monthly for each person they insure. This type of payment arrangement is known as capitation. Caput means head in Latin, so capitation means that the program is paid a certain amount per head, aka per person. This is an example of the bundling I was talking about earlier. Since the provider will only be getting a fixed amount per patient, they are no longer incentivized to give the patient as many services as possible. In fact, they are incentivized to do fewer services, which will hopefully save healthcare dollars. As a side note, bundled payments are technically different than capitation, but I think the idea is really similar, so I'll just leave it at that. Alright, to summarize, Medicare Part C is just a different spin on providing Medicare coverage. It's offered by private companies, and these plans offer at least everything that Parts A and B do. Is it better? You decide. Okay, so that's it for the low yield part. Now for the high yield stuff. We didn't make a symbol for Medicare Part C, because quite frankly, it's lower yield than Parts A and B. We also have a good text mnemonic for this based on the letter C. Ready? Here it is. C stands for combination, companies, and capitation. Combination, because it's a combination of Parts A and B. Remember, Part C plans are all-in-one Medicare plans. Next, companies, because Part C plans are offered by private companies that are, of course, approved by Medicare. And lastly, capitation, because the plans are paid a certain amount per person or per head. Finally, let's discuss Medicare Part D. Again, we don't have a symbol for Part D because I have a better mnemonic. The D stands for drugs. More specifically, prescription drugs, meaning inpatient drugs wouldn't be covered, nor would drugs administered in the doctor's office. Remember, those are Part A and B respectively. Anyway, Medicare Part D is not standardized, so it's up to each individual plan as to which drugs are covered. As with Medicare Part C, it's also offered by private companies. Also, as with Part C, it's not as high yield. So just remember D for drugs. Alright, now that's all for the different Medicare parts. Let's do a quick recap. Part A provides inpatient/hospital coverage. Part B provides outpatient/medical coverage. Part C offers combination plans from private companies. Part D provides drug coverage, specifically prescription drug coverage. Alright, now we're going to shift gears and talk about the other program, Medicaid. Let's switch to the other side of the image and look at this first aid kit here. The aid in first aid should remind you of Medicaid. First aid for Medicaid, right? There's a lot of complexity here that isn't really that important. Instead, let's talk about what Medicaid mainly does. First, notice who's holding the aid kit. It's a state trooper. Like most state troopers, this guy's pretty patriotic. His car also sports the American flag. By the way, the presence of the state trooper and the American flag helps me remember that Medicaid is jointly operated by the federal and state governments. This is in contrast to Medicare, which is a purely federal program. In Medicaid, the states draw up their own plans, which they then submit to the federal government for additional assistance. The federal government sets standards for and approves the state plans, after which it provides additional funding. Since the states have a lot of control with Medicaid, Medicaid eligibility and benefits can differ from state to state. This has only gotten more relevant with the passage of the Affordable Care Act, after which some states have supported different Medicaid expansions than others. But that's a topic for another time. Just remember our state trooper here to remember that Medicaid is a joint state and federal program. Now let's talk about why our state trooper has the first aid kit out anyway. You see, he was helping out this poor family who just got mugged. See the father there? He's got quite the black eye. And it looks like the attacker even emptied his wallet. Anyway, the empty wallet and the destitute family here should remind you of who Medicaid is designed to benefit: people with limited income and resources, especially poorer families with children. Medicaid is primarily targeted at helping poorer families pay for medical bills. Just remember our first aid kit helping out the less fortunate family, and you'll have Medicaid under wraps. Alright, now that's it for our quick summary of Medicare and Medicaid. There's obviously a lot more to each program, but hopefully this mnemonic gives you a good foundation you can start attaching additional complexity to. Now let's do a quick recap before we close out. Medicare and Medicaid are two separate programs with different functions and beneficiaries. Medicare is a purely federal program, so it's not run by the states. It provides coverage to the elderly over age 65, patients with end-stage renal disease, and younger patients with disabilities. Medicare also has 4 parts, termed A, B, C, and D. Part A covers inpatient/hospital care. Part B covers outpatient/medical care. Part C is a combination of parts A and B that is offered by private companies. And Part D covers prescription drugs. In contrast, Medicaid is jointly operated by state and federal governments. It helps with medical costs for people with limited finances, especially poorer families with children. Alright, now we're actually done. Give yourself a pat on the back. You can now tell Medicare and Medicaid apart. Maybe you can whip out this knowledge at dinner parties to impress your friends and family. Or maybe it'll help you get a question right on test day. Either way, I hope you enjoyed it. We'll see you next time.